We wanted to really quickly just sort of give you an overview of what we were going to be going through this evening. So we'll start with a project overview where we share a little bit about the data, the process of getting the data, and who the participants were, who we talked to. Then we'll also go over some of the key findings that we found there. And then we'll dig into talking about some community resiliency and reasons for hope that we found, because a lot of it paints a pretty bleak picture of trans health in the South, but we also definitely found a lot of reasons for hope that we'll dig into. And then we're going to jump into additional resources, which can also be found in the focus group report on pages 24 to 27. But we've pulled out a couple of those to go over with folks. And then we'll have some time for Q&A also. So if you have questions that come up during the webinar, you can drop those in the chat box, and we'll either get to those immediately, or we do have some time specifically for that also at the end.
Great. So as Ivy mentioned, we're going to jump in with a little quiz, and Ivy's going to get you set up with how to do that. I know they mentioned a few minutes ago, but we're going to use an interactive app. You can do this just via text on your phone. Ivy can tell you a little bit more about that because they're more familiar.
Yeah, so we're going to use Poll Everywhere for the first couple of slides here, and then a couple times throughout the presentation. And this is just a way that we can engage with each other. So you can join the session by texting Ivy Hill 619 to the number 22333. And if everybody would take a second to go ahead and do that, if you're able to. And then this question will pop up for you. You'll be able to respond to it just by texting once you've joined the session. And this is going to create a word cloud for us. So once you've joined that, if you'll text in a few words that come to mind here, when you hear trans health in the South, what comes to mind? And again, you can just text that.
Looks like there's a freeze on the screen.
Okay.
Oh, there we go.
A couple of things coming through.
Oh, wow.
This is great. And
wow,
y'all can,
we're seeing things.
yeah, y'all can continue to text in, and I think that this is very much in line with the research that we did. You know, resilience is one of the key things that really stands out to me when we talk about this community and the findings of the research. You know, there's a lot of need, and there's also a lot of resilience.
Yeah, so thanks for participating. You know, this is ongoing research, and we're still learning more about trans health in the South, and we love hearing feedback from other folks and things that come to your mind and what you think about when you hear trans health in the South, so that we can all work together to build a better life for our folks. And we're going to continue on with our quiz. This next question is, how many transgender adults live in the U.S. according to the Williams Institute?
And you can answer this simply by texting that same number. You can answer by texting A, B, C, or D.
Yeah, and so this number, in 2011, the Williams Institute put out a report saying that around 750,000 transgender adults live in the U.S. Now, that was in 2011. 750,000 trans adults. That's about the population of Boston, Massachusetts. And then again in 2016, the Williams Institute updated their data. And what they found and what they suggested and estimated was that 1.4 million trans people actually live in the US, or that's even just trans adults live in the US. So that's a large community of folks. This isn't a small group of people we're talking about here.
Absolutely. Absolutely. And that's part of why we wanted to take a minute to have this conversation and really frame up just how large the population is here that we're talking about. This is not an insignificant number of people. And so that's how many trans adults live in the US. Our next question for you is how many trans adults live in just the South? And you can answer this one again by texting A, B, C, or D to the same number above.
So people who study demographics in the US have suggested that about a third of the US population live in the US Southeast. And if we think about how many trans people are estimated to live in the US at about 1.4 million, a third of that is a little under 500,000 people, but what we're seeing is estimates suggesting that more than 500,000 trans people live in the US Southeast. So even in the South, where a lot of folks think that maybe there's less of a community down here, we have a lot of folks in the South. And what we'll find in our study and what we'll talk about tonight is that the community in the South they're doing a lot of really great work for trans folks coming together, so they need a little more attention than they've been getting.
Absolutely. So this one is more specifically about healthcare. So we've figured out how many trans folks live in the US, how many of us are here in the South. And when we talk about healthcare, how many trans folks do we think just over the last year did not seek healthcare solely for fear of mistreatment? So this is not because they didn't have money or they weren't insured, but just for fear of mistreatment. How many folks do we think were not going to the doctor?
Now, our research for this project was qualitative, meaning we listened to people's stories and their lived experience, and we're really focusing on the content of those experiences. There has been large data released in recent years pointing to widespread disparities, and we can kind of look at statistics in those data sets. And what the US Trans Survey suggested from the National Center for Transgender Equality, they suggested that about 23% of trans people didn't seek care in the last year because they were afraid of being mistreated. Now, this mistreatment could be misgendering or verbal harassment, stigma experiences. And what they found was about 23%. And what that looks like in the South is about 115,000 transgender Southerners not seeking health care because they're afraid of being mistreated. Yeah, and then the next question we had for you was how many trans Southerners didn't seek care because they were afraid of being mistreated. Now, what percentage of trans people do you think are actually mistreated by healthcare providers?
And just over the course of the last year, right? So not like have ever been mistreated, but just in the last year, how many do we think experienced that?
Now, if 115,000 trans Southerners were afraid of going to get care because they were afraid they were mistreated, that would amount up to about 23%, 24% of people. And so if we look at the number of people who were actually mistreated, that number is actually much higher. And we find that 33% of trans people who have seen a doctor in the last year reported being mistreated by a healthcare provider. And those numbers are staggering. So we're hoping to draw attention to some of those things tonight.
Absolutely. And I think that just really hammers home for me how broken the relationship between trans folks and our care providers really is. And we will dig some more into that. And one way that we see this show up is with life expectancy. So we have one last question for you in this set of questions here, and that's, what do you think the average life expectancy of Black trans women is? And you can answer that again with the same.
When we think about community health interventions and how we can create programs to serve the health needs of the trans community, we really have to think about how we serve trans people and meet the needs of the most marginalized of our community. And when we look at the life expectancy rate of Black trans women, and we see that that rate ends up being 35 years of age, then we see that we really need to think about these programs in terms of how racially inclusive they are, how gender inclusive they are, and how these programs are being designed and being staffed by people within our community who look like everyone in our community and who can provide the services and the care in ways that are specific to the needs of our community members. So thanks for taking that quiz. We're going to jump right into the results a little bit and talk, well, first we'll talk about the project overview, and then we'll talk about some of the results. So Ivy, if you want to give a little overview of the project.
Sure. So the data that we've collected came through 4 focus groups where we spoke with 48 participants across 6 southern states. So the states that are represented in the data are North Carolina, South Carolina, Alabama, Tennessee, and Arkansas. And then we have a little bit more specific demographic breakdown here that Austin can run through. And I'm sorry the image is a little bit blurry, but that gives you good reason to go check out the report for yourself instead of just my screenshots.
Right, please do go check out that report and really dig into the results. We had a pretty good amount of diversity in our sample. We had pretty good gender diversity with 21 participants being trans women, 9 participants being trans men, and 16 identifying as non-binary or gender non-conforming. And 2 folks didn't share with us that gender identity. In terms of racial diversity, 18 of our participants identified as Black, 1 participant identified as Latinx, with 5 identifying as multiracial, and some of those 5 also identified as Latinx and Black. And then we had 24 participants identified as white. Now, we know that we need to do more outreach in terms of folks of color in our health research so that these results can be as applicable to our community as possible. And we're working on some of that we can talk about after this presentation. In terms of age, our sample was quite diverse, with the vast majority falling between 18 and 34 years of age. We were really excited to see, though, that we had some participants over the age of 55 so that we could really shed some light on the experiences of the aging members of our community who are often left out of these conversations. We also had pretty good diversity in terms of level of education, household income, and health insurance status, but the vast majority of our sample were in the lower income range, below $30,000 a year, with less than high school diploma or less than a 4-year degree. And many of our participants were uninsured. So keep those numbers in mind when we're thinking about the health experiences of trans people and the unique needs that might crop up.
Absolutely.
So
this
key
jumps
findings.
into findings. Yeah, sorry, go ahead, Austin.
Oh, I was just going to say the key findings here, we're going to touch on just generally speaking. We really encourage you to dig into the details of this on the report online and try to, get really the deep content of these experiences. But we did want to give a general overview. And what we found were that trans people in the South face a lot of different barriers to healthcare, and that these stem from a lack of awareness around transgender identities and experiences, broadly speaking. And with this, think more of like a lack of a cultural awareness of trans people's experiences. So a lack of understanding in terms of how to interact with trans people, the appropriate terminology to use, a lack of comfort around trans people. They suffer from a lack of education in terms of their providers being educated on the ways that their health experiences are unique from other folks or not unique from other folks, and in terms of how best to go about treating the bodies and people in those bodies for trans people. And then also from a lack of imagination in terms of the way that people are experiencing gender and gender identity. and the ways that different trans people have different experiences of the body, different experiences of their gender, and that providers need to be aware of that. And we found that this lack of awareness, lack of education, and lack of imagination led to limited access to care for trans people across the South in a variety of ways. This limited access manifested in terms of, in ways such as being denied care outright. This also came up in terms of trans people being dropped from their care when they would come out to their providers, or having inconsistent access to care. Participants were mistreated in ways such as misgendering and verbal harassment. They were being called the wrong names by administrative staff, by clinical staff, being harassed by other patients and by staff members, being whispered about or neglected. And they also experienced intersecting barriers to care. So whether they were a person of color, whether they were lower income, whether they lived in a rural or urban area, all of these things further affected their access to the highest standard of care. And this, when we're talking about limited access to care, we're not just talking about transition-related medicine. Trans people in our study face barriers to receiving care for even their most basic health care.
Absolutely. I mean, we heard about some, which you can dig into the report and read more of that stuff yourself, but we heard, you know, issues like people being prescribed the wrong medicine, being forced to wait in the hallway at the hospital and not being treated when they were in pain and had hurt their back. So, you know, not at all just transition specific care, but really across the board. And this can paint a really bleak picture of trans health in the South, and that's true, but also at the same time, we did find these incredible pockets of resilience that are expanding every day. And largely the piece I want to focus on here is this peer-to-peer support and just how essential the role that other community members play, how profound that is, and the quality of care that folks are going to be able to access, and being able to find doctors who will treat them at all. So a lot of these relationships are coming out of community networks and grassroots leadership. So sometimes these are nonprofit organizations, and sometimes they're really just a community has a couple of really powerhouse leaders, and they're doing the work of connecting their people. And one of the things that really has continued to resonate with me since having these conversations with folks is just how impactful those relationships are on folks, and that anytime you're doing the work of connecting marginalized communities, specifically trans folks, with each other, that is health work. Even though that may not feel like actual clinical health work, that is developing and nurturing these peer-to-peer support networks that are influencing folks' ability to find a doctor who will treat them, but then also they feel more empowered to advocate for themselves when they know that someone else has their back and they're not like the only trans person in their community. And they have that support. So it's increasing their access to care and increasing the quality of the care that they're accessing at the same time.
Yeah, so we've also included, in addition to local community resources and trans people and grassroots leaders being serving as resources for their community, we wanted to include some resources for providers, for local organizations, and for trans folks who are doing health work. So if you look in the back of our guide, we include a lot of national resources, but we also include some of the local resources. So at Campaign for Southern Equality and Western North Carolina Community Health Services, those resources are listed at the top. And if the Ivy can speak a little bit about the Trans in the South resource guide. I think it's the 3rd edition, is that right, Ivy? That just came out recently.
Yeah, this is our 4th edition of the Trans in the South Guide. And this year it includes over 400 providers, and we're really shifting from this PDF and book version of how it has lived in the past to this year. There's now an interactive map. So you could actually go on to the website where the Trans in the South Guide lives and visually see what providers who are trans friendly are actually closest to you. So that's been really neat. And Also, a point that I think is important to mention, since we just published this in the last couple of weeks, I've already had over 125 more providers requests to be added to the guide. So that leaves me with some work to do of calling folks and making sure that we can include everyone, but also really reminds me just how much reason for hope there is. And, you know, the guide already at over 400 is more than twice as big as it was when we published the first edition. And there are just so many other resources out there. I feel like we're finally starting to crack the code on how to maintain a guide where folks are able to update that easily and find more providers who live close to them. So that's this Trans in the South guide up here, and that's available in both English and Spanish on Campaign for Southern Equality's website. We also offer trainings on trans issues to schools, colleges, universities, medical providers, hospital systems, nonprofits. So if that's something that you or an organization that you work with may be interested in, you can reach out. And we would be happy to get some training for your organization there. Also, in talking about how important grassroots leadership is in the role of health, and that oftentimes these leaders are not necessarily part of nonprofits and they're not getting traditional funding to support their work. Campaign for Southern Equality also offers the Southern Equality Fund, where you can apply for up to $500 grants if you have an idea about some clinic you want to provide or training you want to provide in your community, or ways to get resources to folks who you're working with. This is another resource that we offer. And also found in the Trans in the South Guide and separately is this ICD-10 insurance codes for transgender health. We worked with folks at Western North Carolina Community Health Services to develop this. But it's a PDF that shares both some codes that are commonly accepted and rejected concerning trans health. And then the last one that we wanted to include up here that we'll go into a little bit more detail about is just this video, Trans Voices for Healthcare by Polly Shattle, who is based in Asheville. And this is a resource from Western North Carolina Community Health Services. It's linked through in the report itself. It's about a 12-minute video of trans and gender nonconforming patients at Winches talking about their experiences accessing healthcare and what works really well for them and where there's room for improvement. So we think that's a really helpful tool also in getting some trainings to folks. If maybe you don't have the resources to do a full training, that can be a great resource for people.
Yeah, and we've also included some links in the PDF report to peer-reviewed professional journals regarding transgender health. These journals are really great for healthcare providers. These are really great for administrators in healthcare systems or social work folks who are interested in the latest research in treating trans folks and in terms of best practices. So we put those there, and then we also linked to some national reports about trans and non-binary health and experiences, generally speaking. And we've also included at the back of this report resources from national organizations, such as, in particular, I find one that's very helpful is the one at the top, the Transgender Health Learning Center at the Center of Excellence for Transgender Health. This has everything from links to best practices to the latest in health research to protocol for treating trans people. And you'll find a lot of other resources on this page too. If you go further down the page, you'll see standards of care and clinical guidelines from the World Professional Association for Transgender Health, as well as from the Endocrine Society or from the American Psychological Association. And these things will help providers who are interested in helping trans people in their local communities, but maybe just don't have all the information. We've tried to compile this list for you to make your job that much easier.
Absolutely. One more that I will highlight while we're here is the Fenway Institute. They have a lot of really great training videos that are totally free on their website. Again, like if you're trying to get training to your organization but are being told that there's no budget for that, this is a great way that you can do some basics and help improve a little bit, but then also their Transgender Health Echo project is really great out of the Fenway Institute, particularly for folks who are serving trans folks in rural areas and may not have a ton of experience, but are wanting to do better. This is a way that they're using telemedicine to connect providers with other providers who may have more experience working with trans folks, and really creating those opportunities for folks to network and share resources with each other, which is going to increase the quality of care that trans folks are accessing.
Yeah. So we didn't include it in here. Before we jump to this question, I do want to highlight, we didn't throw it up on the screen, but I want to highlight that at the end of the report, we have recommendations for healthcare providers, clinics, and healthcare systems for things you can do right now if you're thinking about how best to treat trans folks in your community and how to address some of the disparities that we've talked about. Then we have this list for you, and we're happy to answer any questions about that as well. But if you're wondering what you can do today, like simple practices within your organization, please do check that list out as well. So now we can go to, what did this presentation bring up for you? What did this report bring up for you? What have you been thinking about in regards to trans health?
So you can use the same number that we were texting earlier, and if any questions have come up for you, you can just text those in. Again, your name won't be associated with them on the screen, but I thought this would give maybe our shyer folks an opportunity to chime in with some of their thoughts. Absolutely, we do have more work to do.
Oh, you're welcome.
Thank you.
We're so happy to be able to do this work. It can be hard, I think. We heard a lot about, you know, how life can be hard for trans folks in the South, but we also heard a lot about how trans folks are really doing so much work to make it less hard for others around them. I think Ivy mentioned this earlier in the webinar, but when folks were speaking about having difficulty finding care in these focus groups, every time they brought that up, so many people in the room rushed to make sure that they had care that they needed when they left that day. So even when folks are really, you know, sharing the things that are going on in their lives and how hard it is, they turn right back around to make sure that someone around them, that their neighbor has the help they need. So I saw a lot of hope and I saw a lot of resilience. So the question that came in of how can we improve the system, I think we really have to invest in trans community and the grassroots leadership that is making a huge difference. We heard stories about folks, grassroots leaders setting up rapid response HIV testing, blood pressure monitoring, wellness activity, motivational tracker type things, so that they could, you know, think about the health of their community and how to improve that health by creating new community systems for the people around them.
Yeah, absolutely. I just wrote about this in a piece that I wrote for The Advocate too also, but they're in every focus group that we did, there were several folks who would say that they were having a hard time finding a provider. And every single time, the folks in the room really were sharing information with each other immediately. As hard as we would try to keep the conversation on track, the most important thing for them to be doing right then, which was clear to everyone in the room, was sharing resources with each other. And so that was just a really beautiful thing to get to witness, of just how much, even in live time, how much these local leaders and other community members are really supporting each other.
How can we fix the relationship with providers and trans folks? I think that, and like, I think several of these questions, so how can someone already in the professional helper role help more? I think what we saw in addition to this resilience that's happening in the community is the effect that that has, the effect that the grassroots work has on trans people when it's connected with local professionals. So when organizations were connecting with local healthcare institutions or professionals in their area, they were better able to connect local trans folks with those resources by vouching for them, by providing trainings with them, by getting those providers comfortable with local trans people in their communities to see the community members that they are treating. So I think that reach out to local leaders in your community, figure out what health work is being done already and how you can best support the local community organizations out there doing this work.
Yeah, I can definitely echo that Austin is sharing there, and to dig in a little bit on how the relationship is broken between providers and trans folks. Thank you, whoever texted that in. That's absolutely true. So the whole basis of our relationship, the whole foundation of that is based on mistrust. For trans folks, when we go to the doctor, we have to prove that we're trans enough in order to receive the transition related care that we are seeking a lot of times, that you've answer all the questions the right way, that you've felt this way long enough, then maybe you know what is best for your body or what you want for your body. And for us trans folks, there is a mistrust of providers because we have been experienced all of this mistreatment. 33% of trans folks in the last year were mistreated by their healthcare professionals. And I can only imagine, if we had the data looking at that over a lifetime, how many people had experienced that at least once. I imagine that would be a very high number. So one thing that we saw from folks that seem to be having a real impact on that relationship is when local community leaders are reaching out to healthcare providers and inviting them to come and support events that they're doing. And healthcare providers are showing up and reaching out to community leaders and saying, hey, I want to support. Maybe I'm a therapist and I see that there's this summer camp for trans folks. I want to come and provide services there. And that also gives folks an opportunity, gives trans folks an opportunity to see their providers outside of that clinical scary setting and start to repair that relationship.
Yeah, and I just saw this other question come in about how can I personally, as a mental health professional and community organizer, break these gatekeeping rules. I think that, it's on those of us in professional roles to start educating those of us around us in the professional roles around us so that we can change the systems we're in. Connecting with local community leaders can help us identify the needs, help us identify the gaps in care, and help us identify the areas of the system that aren't working. But we really need to turn to our peers in our medical professions and our educational institutions and help them understand how they need to, what kind of work they need to do to make the organization a better resource for trans people. And what that looks like in terms of, breaking gatekeeping rules is treating a trans person as a unique individual and not relying on a medical model to do so, or just kind of not relying on a stereotypical medical model, assuming that all trans people have a general transition experience. Understanding that each trans person's relationship to their body is unique, their relationship to their health care is unique, and that the most important thing or kind of component of helping a trans person is listening to them and trusting them, like Ivy was saying, when they tell you what they need for their bodies. And within all of the power you have within your profession, putting the trans patient's experience with their body first. Yeah, I think that, a lot of people, the burden is on us to educate our peers, and that gets really exhausting sometimes. But it's so important because we found that one bad experience among participants could lead them to delay seeking care for years into the future. So it's important that we do this hard work so that we can reduce these negative experiences so that trans people aren't delaying care that they need.
Absolutely. And if you feel like you're out there screaming by yourself, feel free to use us as a resource. We'll come in and scream with you also.
Yeah.
Where is such a camp? There is such a camp. Shameless plug for Camp Gender Benders. It is a summer camp in northern Georgia for trans folks.
Yeah, like a summer camp. Check that out at genderbenders.org to see how that organization is doing cool health work in the South. We also partnered with a couple of other community organizations for this research, and we want to give a shout out to them. Out Memphis and the Ninth and Orchid Society. Ivy, do you want to say a little bit more about those partner organizations?
Yeah, so our folks who helped us organize these focus groups are doing really incredible work in their communities. The folks at Out Memphis, headed up by Kayla Gore, who's also doing some other health research with the Campaign for Southern Equality. And in that focus group, we talked to folks from Tennessee and Arkansas. And then also the Knights and Orchid Society is a really incredible trans-led organization doing amazing work based in Selma, Alabama. And so I'm just really so inspired by both of those organizations continually. And then the shameless plug for Gender Benders, which I happen to be the executive director of, and we were the third grassroots partner on the project.
Yeah. So Gender Benders is based in Piedmont, South Carolina, right around Greenville. Knights and Orchid Society is based in Selma, Alabama, and Out Memphis is based in Memphis, Tennessee. There are links to these organizations at the back of the Trans Health Focus Group project report, but we can also link them on the website where you linked to the webinar. Will do. Yeah. Thank you all so much. We have some time for some more questions if anybody has any more. Oh,
all
great.
Right,
Thanks
Quartz,
so much for
Quartz is awesome.
adding these other organizations. Great. Well, thanks so much. If anyone has any more questions, feel free to email us. Ivy, if you want to click over to our email address.
I was just wondering if there's going to be, real quick, I'm sorry. I was just kind of wondering I was wondering if there's going to be another group of focus, another study, another group.
Well, right now we don't have plans for another focus group right now. What we're doing currently is wrapping up an LGBTQ Health in the South survey online. You've probably seen a little bit about that floating around on Facebook or timelines, us trying to recruit folks from around the South to take that survey. So we're still focusing on health among queer folks in the South, but we're opening it up a little bit to talk about LGBTQ health. And we're doing an online survey, which gives us access to a wider range of data and a lot more experiences. So we'll be putting out reports around that later this year.
Thanks for all you're doing.
And one of the next steps for us is after doing this is just seeing how great the need is for cultural competency training for providers, especially around trans issues. And so we're going to continue to work on making our training programs more robust and accessible for folks. So we're looking at piloting a couple of new projects. Keep an eye out on our social media, and we'll share more about that as soon as we're able.
Thank you all so much for joining us. We hope you have a wonderful night.
Yeah, and our contact information is on the screen there. I think everybody got an email from me, so feel free to shoot me an email if anything else comes up for you. And we're so grateful for you all for joining us this evening.
I'd like to
Thanks so much, y'all.
Thank you.
Oh, sure.
I'm sorry, just to add in there, I think someone mentioned winches. Can you explain what that is?
I'm sorry, that was probably me. WNCHES is an abbreviation for Western North Carolina Community Health Services. They're a community health center based in Asheville, and they're one of the few. They're definitely not the only one, but every community health center should have a transgender health program and doesn't. And so WNCHES has a pretty robust trans health program that is really great. And that's what winches means.
Thank you so much. That's so helpful.
Thank you.
Okay, well, thank you all for joining in. And if nobody else has any other questions, then we will let you get about your evening. And we appreciate y'all all very much.